All right, good afternoon. This is Matt Smith, the Chief Executive Officer here at Clark Regional Medical Center, and we are bringing some awareness around colorectal cancer Awareness Month, and I'm with two special people, physicians here at our hospital. Dr. Bartee, why don't we start with you, and maybe if you'll introduce yourself and talk a little bit about maybe how long you've been in the community, and then Dr. Reynolds will go to you after.
I'm Becky Bartee. I'm a general surgeon who's been in Winchester for 27 years. I came here right out of my residency and never left. So I do a wide range of general surgery, and colon surgery is one of the things that we offer at Clark Regional.
Hey, I'm Greg Reynolds. I'm a GI doctor here, a gastroenterologist. I've been in Winchester for just over 10 years now. I did my training at UK and came here right afterwards, and also have stayed here. So GI docs are often on the front line of colon cancer screening by doing colonoscopies, and we also offer a wide variety of therapeutic options. So most of our colon polyps can be removed right at the time of colonoscopy. But if we do find a colon cancer, fortunately we have the backup of our talented surgeons here that can take care of these issues for us.
I do want to ask a little bit about, not to make it too technical, but some of the technical components of the process from a screening colonoscopy and maybe some other therapies or interventions. And I do want to pause for just a second. And, this story really kind of hit home for me. I'll pick on Dr. Bartee. We had a hallway conversation, and it's so nice to be at a community hospital where we can get to interact with each other and pause for just a few moments to, quite frankly, just check in on each other. And you did that for me. The screening process, maybe we'll give your all's sort of perspective from, not that we want to talk about age or if you've had your colonoscopies or not, but maybe when we want to, give your perspective, much like my story. And then we'll maybe talk about the process of even scheduling or which one's first as far as intervention or therapy or ages or what have you.
Sure, yeah. Since we're all being personal, I just had my colonoscopy performed as well. So the important thing about it is that colon cancer often is preventable disease. So if we follow the guidelines and get appropriate screening intervals, we can remove polyps sometimes in a matter of seconds that if you're not screened could transform into a full-blown colon cancer, which might require multiple different avenues of therapy.
We got moved because we added a partner, and so we needed more room, and so we're on the second floor of Building B, and our office number is 859-737-9900, and he is on the third floor of Building A.
Yep. And we are at 859-737-6488. And so if you need a colonoscopy, there are different ways to approach it. You can talk to your primary care provider, or you can just call our office because, most insurances are going to cover your colonoscopy if you're of screening age. So you can just call us, and if we think it's necessary for you to come into the clinic to have a visit before, we will do that. Sometimes, for healthy people, we can just go straight to the colonoscopy, and I would talk to you before the colonoscopy. And then we kind of take it from there. So the colonoscopy itself only takes about 15 to 20 minutes. And that's for a very thorough exam. And here at Clark Regional, we're proud to have cutting edge technology.
You've heard it here from Winchester General Surgery, Dr. Becky Bartee and Dr. Greg Reynolds at Clark Digestive Care Center.